Good morning, good afternoon. I'm Liz Powell. I am the founder and head of G2G Consulting. And I'm going to kick things off today. We've got amazing speakers with phenomenal insights on working with Department of Defense, working with accessing funding for life sciences, how to grow life sciences, biotech, and ultimately help patients. So really excited for today's discussion. This is what we're going to cover. We'll start out with a little bit of background, and we'll talk about driving life sciences growth. We've got an amazing expert, Tyler Alchin, who's going to guide us through that conversation. And then we will provide an overview of the military medical funding process, how it all works. We'll talk about how to track the different funding opportunities that are out there. And then we're going to get into MHSRS and all things with this amazing annual military medical conference, the conference of conferences when it comes to advancing military medical innovations. And we're going to close out with a bit of a fireside chat between these experts so that you can get some good takeaways. We also want to hear from you and know what questions that you have. So use that Q&A box throughout, and we will get to those at the end. So just to start off, I want to provide a little bit of background on G2G in case you're new to G2G, which is on the next slide. So we have been around almost 20 years, which is crazy. I started G2G in 2007. After working on Capitol Hill myself, I was a legislative director for a couple of different members, and I staffed the Armed Services Committee as well as the Small Business Committee, and worked on a lot of health policy issues. I've built up an amazing team, bipartisan, with lots of background working in and with government. And we have now secured $612 million in government funding since we started. Not all for life sciences, but a lot of it is. We've worked on CMS reimbursement, just shaping the regulatory process, lots of advocacy campaigns. And we work with various collaborations, coalitions like Women's Health Advocates and many others. We're really active in the Defense Health Research Consortium and have been lobbying for funding for military medical research that benefits a lot of the life sciences in particular. So with that, I will pass it over to my, no, actually, I'm not going to pass it to Aditya. I'm going to introduce Tyler. So Tyler Alchin used to be a colleague of mine at G2G. He has gone on to become the managing director of healthcare for Jobs Ohio, and he is chairman of the board for Ohio Life Sciences. He's brilliant. He knows all things life sciences. He has, over his career, worked in a bioscience company with hundreds, thousands of bioscience companies, with economic development organizations, not just in Ohio, but across the country. He's worked with folks like us. He has done it all, and he has been to MHSRS, so he knows about the specific conference we're going to talk about. So with that amazing background, he's going to share his insights with what's happening in Ohio. It's a wonderful model for other states. It's a great state to grow your life sciences company, and then just his perspective overall. So I'm super excited to have Tyler Alchin with us today. So with that, I will pass to you, Tyler.
Good afternoon. Thanks for the very kind introduction, Liz, and for the audience. I am privileged to lead the healthcare and life sciences vertical at Jobs Ohio, the state of Ohio's private economic development nonprofit corporation. We're a little bit different than our competitors across the country in that we are privately managed and funded, so I'm not a state employee, and we think that allows us a model to reach out to companies both already in the state and outside the state. I would imagine that we've got a mix of companies and researchers and entrepreneurs, maybe some investors on the call today. So we are actively out in the market outside of Ohio and also supporting companies that are already here, building upon a really strong foundation of research and care at places like the Cleveland Clinic and Case Western Reserve, Ohio State, Cincinnati Children's Hospital. Ohio is the #1 state in the country for pediatric care and research. So we've had a long history of life-saving work on the care side of things. And over the last few decades, we've been privileged and fortunate enough to build up an industry around that across the life sciences spectrum. So biotech and therapeutics, medical devices, and digital health. And we really believe that we've got kind of an end-to-end value chain. If you're, striving to take an idea from whiteboard or lab all the way through regulatory approval and into market launch. Maybe as a segue into the content for today that I know Liz and Aditya are gonna, dig into now maybe more than ever, the environment at the federal level. A lot of disruption, particularly at NIH and NSF, kind of historical legacy funders. But really, I think it highlights the opportunity and the critical nature of funding through Department of Defense and military health systems and network nationally. So I think that the timing for the webinar and the conference is really great. We know that our institutions, both hospitals and universities across Ohio, are doing more and more in this space. And although it's a really high ceiling opportunity in terms of funding and partnership and co-development, it's often complex and nuanced. Tends to facilitate or need a facilitator like the team at G2G that knows these systems, knows the team, has pre-existing relationships, all of which they're able to leverage for your benefit. So a lot of faith in Liz and team to navigate again. I think into the future a very critical pot of resources, but one that is not always an A to B pursuit. And we're seeing that, across a lot of our early stage companies coming out of our portfolio in our institutions. So good timing to be pursuing this work, but also can be challenging in a changing dynamic, just like it is on the regulatory side of things. So always easier to do it with a trusted partner that's been through it many, many times before. I have been to MHSRS a handful of times in the past. I think, as I think the team will dig into, I would just underscore the access, right, and the convening nature of the conference. Oftentimes decision makers or influencers on the military health funding landscape might be a little bit, kind of buried in their offices or at their military installations. But this is, kind of your once a year opportunity to get them all in the same place. So if you're considering going or you're considering making an application to a program announcement, I think this is a good way to be in front of project and program managers, and you don't really get too many of those throughout the course of the year. Happy in later content to touch upon my experiences at the conference or anything that you might have questions about with Jobs Ohio, where we are actively daily providing incentives for companies thinking about where they put their next incremental dollar. So in terms of headcount and facilities and payroll, we are incentivizing those with grants and workforce programs and tax incentives. So we build what we think to be very aggressive, meaningful, frictionless packages to help companies of all stages, frankly, navigate to their next opportunity. And we also have a venture fund that you do need to have a presence in the state to have access to, but it's a $250 million follow-on fund that's primarily a Series A funder. So happy to dig into any or all of that as we get rolling here, Aditya. But I think I'll pass it to you to get into the core of the content today. Thank you so much for having me and the invite.
Of course. Thank you so much, Tyler. That was a great segue. I think Heather's going to be putting up the slides very shortly, but just by way of introduction, for those of you who don't know, my name is Aditya Girish. I'm the Government Affairs Manager and Biosciences Director with G2G's team here in Washington, D.C. I primarily work with companies that are in the life sciences, biosciences, healthcare space, in part because I have a scientific background myself. I have a PhD from Case Western in Ohio in biomedical engineering. I was doing a lot of work related to military priorities in the hemorrhage control space. So I've sort of come full circle since I joined G2G. I've been with the team here now for 4 years, and I've gone every single year to MHSRS, and it's been a really, really great experience in understanding how the military health system and the defense health system work. So at a high level, let's just do a quick overview of where we are. So as folks might probably are aware, just very recently in the last few days, the final budget package for most federal agencies was finally signed into law. And so that includes the bills that fund the Defense Department and military R&D. So that's a massive, massive bill funding everything from, your conventional tanks, soldier pay, general procurement, things of that nature. However, buried in that is, significant amount of funding towards medical and healthcare related R&D. Specifically, there's 1.5 billion allocated towards medical R&D that they've designated for specific topic areas. That includes 1.27, excuse me, billion for the congressionally directed medical research programs or CDMRP. We work a lot, G2G works a lot with CDMRP. And so that's a family of about, I'd say 30 or 40 different military funding programs for a variety of different health areas. But it should be noted that they're not exclusively for, what you consider military medicine or battlefield medicine. There's programs for things like lupus, for toxic exposure, women's health. So it really runs the gamut and really, pushes the envelope on, what a lot of people think is military health or defense related health. So that's one big pocket of money in the current funding bill. There's also almost $1 billion for other health-related R&D. It's mostly, from what I can understand, related to technology development or improving process development processes in the military healthcare system. Excuse me. Additionally, besides that, there's a significant chunk of money for DARPA, the Defense Advanced Research Projects Agency. As I'm sure many of you know, that's the branch that funds high risk, high reward research that meets military objectives and needs. Most relevant to folks on this call is the Biological Technologies Office, or BTO. And so they actually got a slight increase, a pretty significant increase actually from in this year's funding bill. So they're at 4.5 billion. Last year they were about 4.1 billion. So that just underscores the point that was made earlier that there's a lot of money being poured towards defense and defense R&D. I don't know how far it's going to go, but the president has in recent weeks suggested a massive budget of about 1.5 or 1.7 trillion, depending on how you read it, for the military overall, and a significant amount of that is expected to go to R&D, including across several different focus areas that they've named in the past few months. I will also stress that, under the current structure, these designated figures here are not all of what's there. There's hundreds of millions of dollars of other monies towards R&D via service branch, that is, the Army, Navy, Air Force designated pots of money, as well as through procurement and hospital programs. So a lot of money out there. Not able to go through all of that here, but just know that it's a very, very large pocket of money that you can look at if you know where to look. And then on the right side, I just want to give a overview of what the military health system is. So that's the overarching description of everything from delivery of care to research. MHS oversees the hospitals as well as the Defense Health Program, which is funded at $41.8 billion. Again, large sum. Not all of that is going to research. A lot of that is going to, delivering care to the 9.5 million or so beneficiaries, probably more than that at this point, across hundreds of MTFs across the country. Specifically, the Defense Health Agency, or the DHA, is the nodal coordinating agency, the combat support agency that is coordinating all that medical services and R&D. It's been a major consolidation over the last few years at DHA. So they're the main body that we typically deal with, when talking about military R&D. And I think we can get to the next slide. So just as a short aside, tracking military medical funding opportunities is challenging, even for seasoned veterans of the federal government. And so our team is tracking military medical opportunities and defense health opportunities every single day, every single week. And we're here to support entrepreneurs who are interested in that space, but just don't know how to navigate it. So a big part of that is grants tracking service that we run, the GBG reporting service, or Government Biosciences Grants Reporting Service. So at a high level, it consists of a report that is published every month around the 10th of the month. That is a comprehensive and updated list of live federal funding opportunities, pre-announcements, notices of special interests, and other opportunities for engagement with the federal government. all agencies, all departments relevant to the life sciences, medical research, and medical technology. And a very large chunk of that is R&D that's put out by the military health system, by DHA, and affiliated consortia, agencies like DARPA. And so just related to the report, we also do a two-part webinar every third Thursday of the month at 12 p.m. Eastern. So 1 week roughly after the report publication. So the first 30 minutes, we're going through key highlights of the report and do a screen share. The second half of that webinar from 12:30 to 1, that is the customers only and members only section of the website where the G2G team, myself, Liz, and some of our colleagues are able to provide more in-depth consultation to folks who are customers, including on trends that are impacting funding, including at DoD, developments in Washington that impacts everyone's bottom line, what we expect to see based on conversations with key stakeholders and leaders. And yeah, so again, details are here. It can subscribe individually, but there's also an opportunity to subscribe if you're a member of certain bio chapters, which I'll get to in a slide or two. Next slide, please. Just for your knowledge, this is just a brief screen grab of a recent report. Specifically, it's focusing on DoD opportunities. As you can see, it's a pretty streamlined, curated report that's designed for ease of use by busy entrepreneurs who don't have time to, do all the scouring and searching themselves. So it has the key information you'd be interested in. Brief description, title, name of the grant, URL, funding timelines, deadlines. And content, I will say, is not limited to a specific any specific federal entity. It's across the entire federal government. And so this is also updated every month, as I alluded to earlier. On this screen here, you'll see a couple of opportunities from Army and from DARPA. The first two from Army, there are broad agency announcements or BAAs or BAs, depending on where you sit. This is a very common military vehicle that's used by Department of War funders that are open for many, many years. Typically, they don't have one clear focus area as opposed to conventional grants that you might be used to from the NIH or NSF. By contrast, they have a very, very long list of topics, often dozens of pages long, on everything, anything and everything related to a very broad topic area. And so they're open for years. And typically, the way you'd apply for these is putting together a shorter proposal or white paper through their portal. And if that's viewed favorably, you go on to the next stage. And so given how wide-ranging these opportunities are, we never recommend, just sending in an application blind and hoping for the best. And so that's why, as Tyler and Liz alluded to before, having a lot of those face-to-face conversations, including at conferences like MHSRS, are so important. Just to understand, what in that laundry list of topic areas and opportunity you actually need to focus on, or what's expired, what's no longer of interest. So yeah, we'll get into that a little bit, but next slide, please. So just to wrap this up, there are about a dozen, actually 13, I think, bio chapters and a couple of other organizations that provide the GBG reporting service to their members as a member benefit. So if you are a member of any of these organizations whose logos are listed here, this is a member benefit for you. You should be able to access that through a link or a newsletter that they send you. Last week, a couple of weeks ago, our January GBG webinar was published, and we had folks from, I think, pretty much all of these organizations dialing into our webinar, and we anticipate this to grow in the future. So if you are part of these organizations or not aware of this benefit, I would reach out to your point of contact. I will also say, to conclude this slide, if you're interested in more curated grant tracking, for opportunities that are also not, necessarily part of this report, that's also something that we provide as a service to folks that we work with. So yeah, I think we can transition on into MHSRS. Great. So going into MHSRS in a little bit more detail. So MHSRS is the Military Health System Research Symposium. And so it is the largest military medical conference of the year. It typically, it's attended by anyone and everyone who is someone in the military health or defense health system, and many, many more. And so it typically takes place in August, either the early or mid part of August in Kissimmee, Florida, at the Gaylord Palms Convention Center. And so we are still waiting on confirmation of the exact conference dates, but that's typically when that happens. So it's very well attended by folks across the board, from the department, from military treatment facilities, from R&D consortia, even the Veterans Department and affiliates of the Department of Health and Human Services. It's open to everyone. Companies attend, academics attend, clinicians attend. And as I said before, it's massive. By far the largest military medical meeting that I'm aware of. So last year, I think there were about 3,500 attendees. In past, it's been 4,000, sometimes even a little well north of that. So this is, technically a scientific conference, but it has all the general structures of any scientific conference that you might be familiar with. So your breakout sessions, 70 or more, typically in a particular year, an exhibit hall for both vendors and others to raise their profile. There's also many receptions. A lot of them are sponsored by some of these organizations whose logos are on the right side of the screen. Those are also great networking opportunities and opportunities to connect with potential collaborators. I will say that the abstract submission process, if you are interested in putting together a podium or a podium presentation or poster presentation, the abstract deadlines are typically around this time in February. It is going to be a little bit delayed from what we've been hearing, but we expect that to be up relatively soon. So if you are interested in actually presenting, which is not a requirement to attend the conference, the abstract deadline is typically around this time, and we're happy to go into a little bit more detail on that in a couple of slides. But just to close this out, you can see on the right-hand side, there's consortia like MTech and BioFab. There's the USAMRDC, that's the nodal agency at the Army that does a lot of their R&D, headquartered at Fort Detrick. There's Walter Reed. There's also, Uniform University of Health Sciences, as well as Burke Army Medical Center. So it really runs the gamut of anyone and anything connected to military health. Next slide, please. So why should you attend? I kind of touched on this a little bit earlier, but the military health system is gargantuan. It's very complicated. It can be a little bit overwhelming. So just attending this conference as a starting point, if you're even remotely interested in anything related to defense health or military health, that's a good reason to attend because it, gives you a stepping stone to understand how this is working, how it all works. It's much more so than, just reading about it online. And so it provides you, through its various breakout sessions, through its preliminary session, insights that you would otherwise not hear about military medical priorities, new and emerging programs, and how you might be able to fit in. And so this is a great networking forum, as are all conferences, but this more so because it's so large and everyone attends this. You're able to build relationships with program managers and leadership in a way that's just not possible at other forums. A lot of folks who attend this just, are not, publicly facing otherwise. So this is really a once in a year opportunity, as Tyler mentioned before. And so you can use this conference in many different ways, elevating the profile of your company, your capabilities, or just your R&D if you're, still in an academic phase. You'll learn a lot about military requirements. That's a term they use, in the military medical context, but also beyond that, and how you can meet those requirements through your technology or through collaborations you can build. And so this is great if you're, interested in collaborating, interested in funding opportunities, figuring out how to navigate all of that. And there's numerous opportunities, sidebar conversations, meals, as I said before, receptions that you can always engage with folks at. It's very broad and not structured in that way. And as I said before, it's open to all. You don't have to submit an abstract or present to actually attend. So that's also another big plus and why a lot of folks are really, including G2G, are very bullish on this conference. We've been going every single year since it's been around. Now, as I said before, I've gone for 4 years in the time that I've been here at G2G, and it's been very valuable in, elevating the profile of clients that are interested in engaging with the military health system. Next slide. So this is just a selection of, I won't read through all of these, but this is just a selection of breakout sessions, some of which we saw were new last year when we went, as well as some continuing ones. Overall, they always lump into four broader categories: warfighter medical readiness, which is focused on ensuring that service members are able to be physically and mentally prepared for deployment, including things like protection, prevention, and medical surveillance. There's warfighter performance. That's the second area. So ways to maximize the physical and mental capabilities of service members in operational environments. Third is expeditionary medicine. So that's focused on capabilities to provide medical care in austere and dangerous environments, including in large-scale combat operations, or LISCO, as you can see on the slide. That's the new term of art that they're using, particularly given where we might be going in the next couple of years and decades. And so that includes things like combat casualty care, field diagnostics, even telemedicine, and then also return to duty. So studies and work focused on rehabilitation, reintegration of injured or ill service members back into the force or back into non-combat zones. As you can see, military injury or biomechanics. That's one example. Blood and blood products, near and dear to my heart, is always a big topic. Also, additive manufacturing, that's something that's come up really in the last few years. They're really looking to secure supply chains as part of broader conversations that people have been having at the federal level. That's also seeped into the military system as well. Next slide. Yeah, just a couple more. So big data, AI, machine learning, the military health system is on top of that and to make that a bigger part of their portfolio. TBI is something that's always been there. They're always looking for better interventions, better prognostics, diagnostics for TBI. And then I think the very first one, VR, AR, MR, was definitely something that was new last year, had a much bigger prominence last year than it had in previous years. So this is just a sampling. There's probably going to be many, many more that they put out for this year. But yeah, just to give you a taster of where that fits in. Next slide. So we'll conclude the MHSRS discussion talking about abstracts. So as I said before, the abstract deadline hasn't been posted yet, but there are, at least based on the last 3 years, there's two different types of abstracts you can submit. One is more of a research angle, so your standard introduction, materials, methods, results, conclusions. So anyone who's submitted to a scientific conference before, that should be familiar. The other is the advanced product development abstract. It makes sense given that this is a military conference that they're looking for, technologies that can fill capability gaps. That's what this is. So definitely, this is something where you have to put that military medical connection a lot more salient in your submission, including how it fits into what they call the roles of care and how it actually benefits the warfighter as well as the technology readiness level or TRL. Next slide, please. And lastly, just some general pointers on abstracts. Again, the MHSRS website is being reformatted, revamped as we speak right now. So some of this may change, but I don't expect it to be drastic. So you do need to create a separate account on their website. There's some disclosures you need to submit. And I will say that the character length, it's not particularly long for what you can submit here. So it's about 2,500 characters. No text, no tables, no videos, which is a divergence from a lot of other conferences that you might be familiar with. And then you also have to connect it with learning objectives because a lot of military folks are going to be attending this to get learning credits. So that also needs to be incorporated in your abstract. And I think that is all before we go into discussion. Can you transition, please?
That was super helpful. Thank you so much, Nitya. Good to have both of you back on. So thought we would just have a little discussion on what does it mean to attend MHSRS? What are key takeaways, things that companies need to be thinking about? So I would love to start with you, Tyler. You've worked in the life sciences for many years with probably thousands at this point, and you've been to MHSRS, as we talked about earlier. So what would you say are some of the most important takeaways for companies?
Happy to, Liz. I think two things to prepare for, and maybe these might feel on the simpler side, but I think they're important to understand going into a conference like this. The meeting style tends to be informal at MHSRS. Although G2G does a great job, and I think would be helpful in scheduling meetings. You're probably going to have a mix of pre-planned, scheduled, more sit-down meetings, and then a lot of standing in a hallway, standing in the back of the room, kind of chasing somebody down. So plan accordingly for that, and do not be taken aback by particularly leadership level or decision maker folks that have a long line of people that want to do the same thing. It's just sort of the nature of the beast at that particular conference. So I think plan accordingly for that, and then the second line or second guidance I'd say was as a follow on to that is to be prepared to get through your pitch or the reason that you're there, your technology quickly. I mean, saying elevator pitch sometimes means different things in different settings to different audiences. I would suggest sort of moving the punchline of what you want to get to up into the first sentence or two, because you may only have 5 minutes with someone, and you got to capture that energy and that interest. So a lot of times companies, us included, when I used to go with Liz in the firm, it's challenging. They're highly technical, long stories for technology or devices or software, but you don't really have the luxury to give sort of the full story of how you got to the conference, right? Like jump in and capture that first minute or two with your audience.
That's great. Those are great tips. Aditya, do you have anything to add to that?
Yeah, I mean, the only thing I would say specifically to that part is that, sometimes it's not even 5 minutes. Sometimes it's like 30 seconds to a minute even. So it's like you have to get them, have your card ready. Business cards, we always take loads and loads of business cards. Make sure, like, if you are able to do some research beforehand, we work on that part a lot when we work with clients and take them to the conference. Like, figure out who you're targeting and what their interests are, get a few keywords out. And then, very often there's follow-up meetings that are more substantive and longer where you can do a deeper dive. So that's the only thing I would add to specifically what Tyler mentioned, but agree with everything else he talked about.
I think this maybe goes without saying, but speaking directly to the need of the program manager or the scientist on the military or the government side of things. I think one really kind of piece of strategy that G2G always used is, and I think it bodes well for all government funding pursuits, is that the person that's in charge of that funding mechanism or that program, he or she wants to see success, right? And if you believe your technology is the enabling piece of that, is the solution, packaging it in a way that's easy for he or she to sort of win on the mandate that is in their program, right? So thinking about how you get from your technology to how it solves what that person's program is attempting to solve, I think is a really good kind of approach or headspace to be in, particularly going into a conference, right? You want to be a solution provider. Yes, you'd like the government to fund your particular technology, but I think speaking through a viewpoint of your technology or your insights, providing a solution for the program manager is always a good bet to get traction.
So I would say, in terms, just to put a finer point on what was mentioned earlier, as a scientist myself, as someone who worked in, an area that was very, very close to military medical priorities, defense health priorities, that communication piece is very important. The way you present your work is going to be very different. Like not to brag, but some of the work I did in my PhD program was actually presented, at the last conference by someone else who joined my lab after I left. And I was really struck by, how differently she talked about it compared to how I talked about it a couple of years earlier. Like, just making sure you are aligning with the jargon that they use. Specifically, how does this meet expeditionary needs? How can this be used in austere environments? You really have to be able to weave that into how you talk about the science, for you to actually get a captivated audience, for folks to be interested in what you're doing, to foster partnerships. And that's something, it takes time, it takes practice to learn how to do that. It's not, just something you read a book and learn how to do, but just going to some of these sessions, learning how other people talk about their work is, in and of itself very valuable.
Okay, I'm going to try again. Can you hear me okay?
Yeah, I can, it's a little shaky, but yeah, go ahead.
Well, I'm going to ask you, Aditya,
Go ahead.
since it's now secured 612 in government funding. What insights do you have about getting
Just to finish that off, so Liz is asking, our team G2G, we're very proud to have secured over many different funding streams and years, 600 million in government funding for our clients, partners we work with. And so, what are some insights on accessing these funds, particularly as it relates to an MHSRS context? I think what I would say is that there are so many different pools, programs of money that are just not well known. And even if they are publicly facing, you really don't know the extent to which, they, have the capability to fund. And so that's a big part. I mean, for one example, we worked with a company a while back who were looking for, support for manufacturing for scale up for a product that, had some military relevance, but it didn't exactly fit into one bucket. So through having conversations with different managers, we found these different consortia that sort of overlapped with what our client was working on, but not quite exact fits for either. So through that conversations that we had at the conference, we were able to put together a collaboration between those two groups and eventually, carve out a specific support mechanism for that company to help, produce this product. So that sort of conceptually, it's not something you would think could happen if you're just looking at a broad agency announcement or an opportunity that's been put out. So that's just something that would not happen if you weren't able to attend this conference and meet with people who are on the ground and know how things work behind the scenes. Um, I would also say that, making sure that this conference is also valuable in, making sure you're on people's lists. So even if they don't have funding now or at a current time, um, you if your priorities align with them and downstream once funding has been appropriated or there's leftover funding at the end of the year, restoral funding as they call it, we getting on their list, getting on their priorities list, getting to know them, that's important because once they have, if they're interested but don't have the resources right now, if in a couple of months, if they do, they will think of you if you have that connection and that alignment. um let's see, what else can I say? The the There was a specific another in the infectious disease space. There was some a similar conversation that we had alignment with infectious disease priorities in the DoD. It's very wide ranging, but folks didn't really know what this client was doing in terms of vaccine and MCM, medical countermeasure development. And so having a conversation with that client with program managers who we sometimes literally just as we alluded to before, you just meet in the hallways, meet at events, at meals. We were able to strike up a conversation with one person who put us in contact with another person who was a colleague of theirs whose needs were more aligned with us. And so we had one meeting, a brief touch point at the conference, several follow-up meetings, and after a couple of months, we were able to secure a standalone RFP for about 1 million for that specific work. So that's another way of how working the conference as well as some strategic serendipity, as I like to call it, works in your favor. Another example, which I'll wrap up with, so some folks already have some ins to the Defense Department. And so, some folks are already working with different military medical research institutions on, you know, uh, some type of product development. And so they've gotten to a certain place, but, they just don't know what to do after. Like once they've gotten approval for a product, it's gone to a certain point, but it needs to be deployed. This conference is also great for that as well. For example, if you're in R&D but don't know how to get to procurement, it's sometimes a chasm in the DoD, and this conference also helps you with that. And so, working with partners and points of contact that we met, we were able to understand different potential lines for procurement to help safely transition something from R&D that the government had supported and prioritized, saying that this was a need that the military had, to actual procurement stakeholders, including prime vendors, including program managers at the DoD, military treatment facility stakeholders, including doctors, surgeons. So we were able to build all those connections through the conference. We were also able to work on background with Congress, who actually appropriates the money for the military and military health system, as well as puts together the authorizations for the military overall. And so through that process, we're also able to build champions in with those legislators, with those offices, and we were able to point to the fact that we had champions at the agencies who wanted this technology move forward and it was a priority for them. So through that process, we were also able to get standalone funding for this general project area of about 1 million in this very recent appropriations bill. So there's a lot of different ways to work it. You can work it standalone with DoD. You can do it DoD with, other engagement that, G2G does here in DC. So it's very, very wide ranging, I would say. Those are just a couple of case studies, and I'm looking to see what other points we want to bring up. Um, oh yeah, I can also bring up. So at the very top, and I'm saying this because Liz has some issues with her Wi-Fi, so I'm just going through all our other points. So I mentioned the Congressionally Directed Medical Research Program, or CDMRP, and so that, as I said, has $1.27 billion worth of funding allocated to it in this most recent budget. So one of those programs, the Rare Cancers Research Program, the RCRP, which is funded at 17.5 million, that is a program that G2G literally stood up several years ago and has been able to plus up and maintain for several years. And that's in part because we were able to build connections both with agency program managers in DoD, where folks who served in the military are exposed to things like Agent Orange, burn pits, and so they have a much higher, unfortunately, rare incidence of rare cancer. So we're able to build that support up at the agency side, but then also concurrently build stakeholders and champions on the congressional side. So we've been able to maintain that funding line for several fiscal years now. So one last example that also was in part fostered by MHSRS. And I realize there are a lot of questions in the Q&A, so let me start going through them. Recently applied for a peer review grant on CDMRP. The funding, as it turned out, was very limited, 50 million, and a few projects were funded. Is that going to change with the new budget? So fiscal year 25 for CMRP was brutal. I'm not going to lie. Unfortunately, in last March, as part of the stopgap funding measure, the continuing resolution that they passed to fund the government through September of 25, to make up a shortfall elsewhere, they took a hack job, essentially 60% cut to CDMRP overall, and several programs were, I think, more than half were unfortunately just completely zeroed out for this past year. Fortunately, through engagement with the Hill, with agency stakeholders, including the director of CDMRP, Colonel Hartel, uh, that budget has been significantly plussed up, not exactly at where it was before, but close to where it was before. So at 1.27 billion previously in fiscal 24, it was at 1.5 billion or thereabouts, I believe. So a lot of the programs that were essentially canceled in this past year have been reinstated. Some of those programs have gotten increases, some have been relatively flat. So to specifically answer a question, need to know a little bit more about exactly which part of the peer-reviewed programs you apply to, but it's certainly a better outlook for this fiscal year than it was last year. Also, when SBIR gets reauthorized, how long before things get up to speed? Very good question. That's another issue that we are working on in tandem with all these efforts with the defense health side. Um, we are engaging with the key stakeholders in Congress, the small business committee chairs, as well as folks at agencies to try and get a reauthorization over the line. So yeah, so once we do get some sort of deal put together, um, yeah, we expect the opportunities to come out fairly quickly. I think there's a lot of stuff that's been triaged in the last cycle that just didn't get put out. So yeah, hopefully once that deal gets through, we will see things coming through pretty quickly. There are some opportunities, pre-announcements especially that I've seen that have been put out, that some by defense health sources as well, that I think were funded or authorized under the previous authorizations. Those are still going out, and existing awards are still being serviced, but new awards and a review of awards that have been submitted after September 30th. Unfortunately, they're caught in this limbo. We're trying on our side to do the best that we can. Very recently, we put together a letter signed by over 1,300 small businesses from across the country, submitted that to key leadership in Congress. A lot of that was DoD, SBIR awards. So yeah, just know that we're trying our best. You can also amplify that through your own channels, reaching out to your members. The more pressure they feel, the faster they'll work on it. Um, let's see. Still working through questions here. So, answered. Vision, which went, I'm not quite sure I understand this. Vision, which went 0 to 29. If you want to clarify that, I'm happy to see if we can answer that. Um, let's see. Anything else? Let me check the chat. Open, answered. Oh, vision. Oh, I see. Okay. That is a good question. Give me 1 second and I can check. Uh,
I'm
vision.
typing in
Yes.
answers. I think
Yes.
that's helpful.
Yes, it has been restored. To answer your question, it has been restored to a level of 10 million for fiscal 26. Any other questions? Any other questions at all? Feel free to put it in the chat. We have some time. We have 10 minutes, the zero time. Quiet bunch today. Oh, let's see. Are there any opportunities for novel quantum diagnostics or biomed diagnostics? Yeah, I mean, I'd have to know more details, but yeah, I definitely think that depending on how you frame it, with, the relevant agency or division at the Defense Health Organization, I think it definitely would be relevant. We just have to know more, but short answer, yes. Um, Let me ask a question to Tyler, actually. You've talked a little bit about how, how the environment is growing in Ohio in recent years. Can you talk a little bit more about what the nexus you all have is to, existing military research facilities like AFRL in Dayton comes to mind. I know there's several others throughout the state. Can you speak a little bit more about that?
Yeah, Wright-Patterson Air Force Base continues to be a driver, both on the base and sort of external in of technology. An incredible partner, willing partner that I think has done more work in recent years to be active, reaching out to sources of IP and entrepreneurs and companies off base. Always a bit of a learning curve, approaching a military base and its leadership with new technology and sort of the pace and process that goes into partnering. But the team there really ingrained into warfighter monitoring systems. They run a high amount of the Air Force's diagnostic blood work and biomarker work through that facility. So really privileged to be working with that team, and it's a big part of our ecosystem. So we have a lot of companies that end up doing work with both our hospitals and universities, but also the base. And between those three, I think you've got some diversity of experience and expertise and different pieces of infrastructure that you might not be able to find as accessibly in other states.
That's great. One last thing, I think, Tyler, for you, um, what do you think companies most need when they we know how that you've worked with? What do they most need when they're sort of starting to engage with this space, with DoD, with anything really military related? Is there something that, they lack? Is that something, you all can help them develop? Can you shed some light on that if possible?
Yeah, in my experience, DT, I think companies that are able to produce an amount of data, maybe not formal clinical data, but could even be physician feedback or preclinical data specific to the need of the military stands the better chance of getting traction, right? And I think easier said than done, right? When you're an early stage, resource starved team, a lot of times you're looking to raise money to then get data to then go raise more money or bring your product to market, or in this instance, partner with the military or form a commercial relationship with the military. But kind of pulling back through my experience with Liz and team and over the years, I think if you believe your technology is a good fit with military health applications, I think it really makes sense to try through whatever means, sort of friends and family round, seed funding, local and state, smaller grant apparatuses to get a small degree of data that's specifically in the area of which you believe that you could ultimately, deliver a solution on a broader funding mechanism. So, if the grant you're chasing with the military is a couple of million, spending 50 or $100,000 through other means to get, some small early indication data, I think is well spent. So thinking about what that inflection point is to get to an interest level.
Great. I think we just have 5 minutes. So Heather, do you mind pulling the slides back up and we can close? Yeah, so as we conclude, I know we've thrown a lot of information at you, but just some overarching tips that sort of summarize what we've discussed so far. Um, MHSRS is one conference. It's, I think, by far the largest conference and what we consider the most important conference, but there are a lot of other smaller meetings as well, some of which G2G attends on behalf of clients and groups that we work with. So tracking that, specific areas like operational medicine, special ops, they have their own conferences, a lot smaller. Those are also valuable if you have technology capabilities that overlap with those areas. That also can help you understand what they're looking for their tailored funding opportunities more so than a generalist. What we do, particularly to help folks who are engaging, is to keep updated on policy announcements. We work with a lot of folks who have very niche interests, and so we're helping them stay on top of all of that, particularly in this environment in this last year or so. To points that were made by Taylor and Liz before, we really, really need messaging that is tailored and to the point. You can't show someone a 20-page slide deck and expect them to get what you're doing, even if they are technically or medically trained. You have to be clear and to the point. We do it in what they call a white paper format. We help people put their capabilities and reframe it in a different way. So that's a big part of what we do. I mentioned this before, but make sure you actually talk to people before you apply to something so you're actually aligned. That's why all these program managers, talking to them is so important at these meetings. Seems pretty basic, but deadlines are very important in the military, so you need to follow them and be on time and on budget. They're pretty big sticklers for that. If you're an external party trying to propose something, and if something costs more than what you say it is, that's an issue. Other stuff, yeah. So a lot of you are probably already very familiar with, the registrations that you do with SAM.gov and things of that nature. But if this is your first foray into engaging with government, we strongly recommend you get all that done before. Um, Other items on this, yeah, short to the point. A lot of those pre-applications for opportunities I alluded to earlier when I was doing the screen share of the report. They're relatively short. They need to be, again, to the point. Typically, you have a short write-up as well as a quad chart, so very, very streamlined. Um, Checking past awards, CDMRP does a very good job of at least 2 years back applications that they have funded. So it's always good to look at those to see what they have funded in past and how their priorities have evolved. And that's, it varies depending on which agency that you're working with, but if you know the right people, you can find it. Um, Consider who controls funding and topics. That is, of course, leadership and program managers, but also on the funding side, Congress, as I alluded to before, building those relationships on the other side, something that we specialize in. And then something we didn't get a lot of chance to discuss is the consortias. They're really key in putting together competitive awards for various applications, including the BAAs. So there might be one or more that you choose to join. A lot of them are not particularly expensive. Some are, some aren't. But that's also another vehicle folks can engage with. And lastly, persistence is key, resilience is key. Those relationships take a long time, but once you're able to get them to a certain point, they're really, really very fruitful. Next slide, please. And then lastly, if this interests you, if you are interested in going to MHSRS or just engaging with the defense health system or any other part of government, feel free to reach out to us. We can do a lot of different things that you might be interested in, whether it's engaging at the conference specifically, putting together post-conference follow-up, a specific plan, and much, much more. So feel free to reach out to me specifically. My email is there. Yeah, we're happy to help and help you grow. And with that, I think Liz is putting our emails in the chat. And I think we're at time, folks. Thank you so much to Tyler for his time today, for joining us. And thank you all so much for dialing in. Feel free again to reach out to any of us. Our emails are on the chat, and we hope to work with you again soon. Thanks so much.